Tim, let me take a look. Let me have you tuck your chin down onto your chest. As far as you can go. Good. And then look up to the ceiling as far as you can go. Okay, good. Come back to neutral. I'm going to have you bring your hands up in this position and tuck your chin all the way down onto your chest. Good. I'm going to have you hold and resist for me as I try to push back. Hold. Okay, so you can feel that's turned off. Tuck your chin down. Turn your head towards your left side. Hold that strong. That's working. Turn your head towards your right side. A little more. And can you bring your chin down? There you go. Hold that for me. Okay, so that's not working. So what happens is when we test you in the middle, both muscles are trying to work, but only half of it's working, and so you're not able to hold that resistance. When I isolate one side, it's on the right side, but off on the left. Does that make sense? Mm-hmm. And we can do it again if it'd be more clear.
No, I felt that.
Okay, so the key thing I'm looking at is when you bring your chin down onto your chest, it looks to me as if there's about 2 or 3 inches of gap between your chin and your chest. Let's see you do that one more time.
It feels better now since you did that.
Okay, well it's about almost 3 fingers distance here. I'd like that to come a little further down. So I think if we activate these muscles, we're going to be able to accomplish it. So there's an instrument I'm going to use with you. This is a laser. We call it cold laser or low-level laser. It doesn't cut tissue, it doesn't burn anything, but it's very bright light, so we want to keep it out of the eyes. So I'm going to wear some goggles to protect my eyes since I'm going to be watching where the light is going. But as long as you're not looking into the instrument, you're not going to hurt your eyes at all. Okay? It's not like radiation. It's like a flashlight, but brighter. Mm-hmm. Okay. So here's what I want to do. I'm going to have you raise your arms up again into this position. Tuck your chin down. Hold that strong for me. Okay. And then just relax, rest your arms down. So the light is going to go at the base of the skull, at the top of the neck, where the nerves from the spine exit and activate the muscles that hold your head forward. Good. Let's have you look up toward the ceiling, all the way up, and tuck your chin all the way down onto your chest. Excellent. Good. And come back up. And all the way up, look up toward the ceiling. Very good. And then all the way back down. So I'm just right now treating the nerves. In a moment I'm going to treat the muscles as well. But look how much further you're able to go. Let me see how many fingers I can get. 1.5. Okay, that's good. Come back all the way up to the ceiling. Looking up. Good. Bring your chin way up. And all the way down. Very good. One last time. All the way up and all the way down. Good. All the way back down. Keep your chin all the way down. 1 finger. Okay. So let's have you bring your arms up to this position again. Tuck your chin down in your chest. And don't let me push back. Give me more if you've got it. There you go. Turn all the way to your left side. Tuck your chin way down. Hold that strong. Good. All the way to your right side. Tuck your ear down. Hold that strong. That's close. It's not quite all the way there.
I can feel it though. Feel it much more symmetrical and balanced.
So there's still something going on. Let's see if we can find out what it is. I'm going to stay with the laser for a moment. We're going to check your spine and maybe make some adjustments in a minute. But before I move any joints around, let's just see if we can activate the muscles and get them to do their job. Once we get all the muscles participating, if there's a joint that needs to be moved, we can move it. Okay? All right. So both fingers come out like this. I should say both hands. Hold in strong. Hold in strong. Okay, so this side's on, this side's off. Does that make sense? Hold out strong. Oh, that's off. Hold out strong. And that's on. So the fingers on your left are turned off, but the thumb is turned on, and it's reversed on this side. Okay. So let's just see what we have to do with that. So this laser, just to give you an idea of what we're doing, is a bright light that has a particular wavelength of 635 nanometers. And it turns out that the research has demonstrated that different wavelengths of light have various effects on the nerves and the blood vessels and the cells of the body. 635 nanometers happens to work really well with nerve cells and muscle cells, which is one of the things I'm most interested in treating. Different wavelengths have other effects, and if you're interested in treating other tissues, you might want a different wavelength. But for my purposes, this is a good one. And I'm going to come around behind you, working so I can get the other side. So, one of the effects of this bright light is that the cells are able to produce more ATP. And ATP is the energy molecule. That's a little tight. Can you feel that right there? ATP is the energy molecule that drives the cell. I'm going to have you tilt your head towards your right side so your ear comes way over here. There you go. And then tilt your head toward the left side. Okay, and then back to your right side. Good, and over to your left side. Good, and we're becoming more symmetrical as we go. So back to your right side. And more to your left side. And relax, okay. So what ATP does is it's the fuel molecule that runs the cell. And so if the cell is able to have a lot of ATP, it can heal, it can remodel itself, it can regenerate and replace itself. Open your fingers real wide for me. Hold out strong. So all of a sudden this is on now. Good. And this is still on. And this is on now. And this is on. And you notice how much wider your fingers are? I could see as soon as you open your fingers, I could tell there was more activity, and I just touch them and they're alive and working. Okay? So what I'm doing now is just facilitating the neurologic message from your spine to the fingers before we move any bones. Now this muscle was really tight over here, which tells me that that vertebra is likely going to be tilted a little bit. Before we're all done, we may want to adjust that one, because we don't want to leave them tilted, we want to bring them back to neutral. But oftentimes, before I start adjusting anything, I want to get the communication between the nervous system and the muscles upregulated, so the body is paying more attention to itself. Then the changes that we make mechanically have a much better chance of lasting a long time, and the adjustment holds. Okay? So that's the model. So while